Well, welcome to the doctors, Danny and Mandy, and I'm so glad that you're here and sharing your story and that I can, be of help to you today. And I just have to say how brave you are, because when you are positive for BRCA1, which you have been counseled about and which you're asking me to sort of help you make the decision, is you have an increased risk of ovarian cancer.
Right.
Okay? So it is recommended, particularly after the age of 35, to have your ovaries taken out. Okay? So you're looking at, should I take my ovaries out now, because you're younger than 35, right?
Right.
And should I take my ovaries out now, and or should I take my uterus out
Right.
as well and have a hysterectomy?
Right.
There are two different ways you can go. If you take your ovaries out, anytime you take your ovaries out, you're going to go into menopause. And that is what you do have to have done regardless of if you take your uterus out. But if you don't take your uterus out, then you have to have the estrogen and progesterone.
Correct.
Okay?
Yeah.
Now, the estrogen and progesterone together have sometimes been associated with an increased risk of breast cancer.
Right.
So, and what a lot of people don't know is you still may have some breast cancer cells left even if you had the
Right.
mastectomy.
Right.
So it is a real concern about what we do afterwards.
Why would you do something you're trying to prevent? Not.
And so it's a hard question. And there's also more of a surgery. If you just do the oophorectomy, you can do it laparoscopically. You just have 3 little, small little incisions, and we just loop your ovaries and we just take them out.
Yeah.
Okay? Whereas a hysterectomy, the least invasive, and I actually did this for another BRCA1 positive patient about 3 weeks ago,
Really?
is a laparoscopic assisted vaginal hysterectomy, where we go in and we do the hysterectomy partially from the laparoscopically, and then
Right.
we go in and we take the uterus out and the ovaries out vaginally. Now, with menopause, you're worried about the symptoms, right? Like the hot flashes and what it'll do to your body.
And I mean, I understand there's increased risk for heart disease, osteoporosis, all those things. And so I wonder, okay, if you do this now, or versus 40 maybe, is it better to wait so that you're not starting that process so early?
It's recommended at 35, and the reason being is, again, you don't want as much of those hormones around, and also because of longer lifespan. So obviously, the longer you wait, the more risk you also have of other diseases and things coming up as well.
Right. And so do the hormone replacements, I mean, do they help?
They definitely, absolutely help with the symptoms, and they also can help with your skin and your hair, and eyesight, all those things. Teeth, believe it or not, are affected.
Right.
So really, if you have the uterus, then you have to think of taking estrogen and progesterone. If you don't, then you have to take just estrogen alone, which we think is actually better. But it is a larger surgery. You may even want to do it in stages. I know I'm doing the worst thing that sometimes people say. Doctors will give me too many options.
That.
So you could do, just the ovaries until 35, because you're younger than 35, and then at 35, go ahead and do the rest of the hysterectomy. It's really, it's kind of up to you. It's a lot of decision making. And again, you're not I know you're negative, but you have to consider whether or not you want to decrease your risks having a positive family history,
Right.
even with a negative BRCA1, which could even be a harder decision.
Yeah.
Okay, and enjoy each other. You guys have such a wonderful
Thank you.
relationship.
We do.
Yeah.
We do.
That's just lovely that you have each other to support each other.
We do.
All right.
Thank you.
And then I want to know what you're going to do.